Hello everyone. So I am presenting my case study on the mystery patient. There's nothing actually mysterious about this particular person, but I chose to talk about him because this case made me take a step back and assess the way that I look at patients and their symptoms. Being at a private practice where I'm continuously seeing geriatric patients with the typical presbycusis has at times caused me to make immediate assumptions and usually classify everyone under this umbrella. Hearing disorders still exist, and just because I don't see them that often, or at least not the textbook kind, doesn't mean that they aren't there. So my mystery patient is a 56-year-old male who was seen for a comprehensive audiological evaluation, and he was accompanied by his wife. He had some significant concerns of decreased hearing sensitivity in both of his ears. It was a little bit hard to get some information out of him, but basically what he was saying in a nutshell was, I'm not hearing the same. I thought I had a cold. Can't really explain what I'm experiencing. He did report that he had chronic vertigo and episodes of dizziness that were lasting several minutes. At times he would get this severe nausea or he would vomit. His wife also mentioned that he was having some issues with his eyes, and so he had an upcoming appointment with his ophthalmologist. There were also unusual complaints related to exposure to loud noises, oral fullness in the left ear, but he did deny any kind of otorrhea, tinnitus, ear infections, or ear surgeries. There's no recent noise exposure or history of hearing loss in his family. All other medical history is unremarkable. This patient was a hearing aid user for the past 5 years, and he did notice worsening in his symptoms in the last few months. Here, what I have attached is an overview of the results of his testing on that particular day. I'll break down in more detail each individual test. So otoscopy. Otoscopy revealed clear canals and visible tympanic membranes on both sides. No visible cerumen or any issues, any perforations or anything of that sort. Moving on to admittance, tympanometry revealed type A tymps. That's consistent with normal middle ear mobility in both ears. Acoustic reflexes were absent at all conditions. It is worth noting that there was a bit of nystagmus during this portion of the test. And here we have the audiogram from 250 to 8,000 hertz. In the left ear, we have a mild to moderately severe sloping sensory neural hearing loss. In the right ear, we have the exact same thing. Overall, based off of his results from the last hearing test, hearing sensitivity has remained relatively stable. And finally, speech understanding in quiet and in noise. Our WRS, word recognition scores, results were fair, 76% in the right ear, 72% in the left ear, when those were presented at elevated listening levels. Presented binaurally, word recognition scores were good, 80%. Quixen revealed actually a pretty significant SNR loss. They have a moderate difficulty in background noise, plus 7.5. And this is something that I don't have any previous results from because the previous audiologist did not do either binaural or SNR, Quixen test. All right, so these were my recommendations for the patient. Obviously, this is not the end of the case. At this point, I don't think I really thought much of it. I think my assumption was, balance was probably something to do with age, and, a lot of it was perceptual. I knew the patient had an appointment with his ENT, so obviously I recommended to follow up with them to review today's results, continue use of hearing aids, and repeat audiological evaluations every year. And finally, here are some of the additional testing that were done right after the appointment with me. So a vamp was performed. Test results were normal and symmetric at suprathreshold levels. The left ear responses were present at relatively low levels, less than 60 decibels NHL. VNG found abnormal oculomotor findings. Positional and calorics testing were unremarkable. And then the final two things that were ordered, an MRI and a CT scan, to try and rule out several things. Let me know what you think.